Hi, I'm Robin Tudor, founder of Empower Total Health, and in this week's weekly update, I'm going to be talking about cancer, specifically cancer prevention. Now, this Sunday, the 4th of February, is World Cancer Day, one of those disease awareness days that's declared by the World Health Organization. And so you're probably going to be seeing a lot of stories about cancer in the media. Most of these stories will be about the latest breakthrough treatments and how you should participate in cancer screening programs, even though the majority of these screening programs have been found to either cause more deaths than they prevent, or they simply lack evidence that they save lives at all. On the other hand, it's fairly unlikely that you'll hear much about a quite recently published study which calculated that nearly 40% of deaths from cancer in Australia, that's almost 17,000 deaths per year, could have been prevented by adopting better diet and lifestyle habits. There are 8 major groups of risk factors that have been declared to be causes of cancer by international research bodies such as the World Health Organization on the basis of solid and consistent scientific evidence. So they are: number 1, tobacco smoke from both active and passive smoking. Number 2, dietary factors, including inadequate intake of fruit, vegetables and fibre, and excessive red and processed meat consumption. Number 3, alcohol consumption, that's any alcohol consumption. Number 4, being overweight or obese. 5, physical inactivity. 6, ultraviolet light exposure. 7, infections such as hepatitis C and human papillomavirus. And 8, use of hormonal drugs such as postmenopausal hormone replacement therapy. Researchers from QIMR Berghofer Medical Research Institute used data from the Australian Institute of Health and Welfare, which conducts regular surveys of Australians' health-related behaviours such as eating habits and exercise habits, and from the Australian Bureau of Statistics to determine how many cancer deaths each year are caused by these risk factors, these 8 risk factors, all of which are modifiable and therefore could be prevented. They found that the most preventable cancers that afflict Australians are those of the lung, colorectal and breast, along with melanoma, and that 34% of cancer deaths in Australian women and 41% in men were attributable to modifiable risk factors. Think about those numbers for a moment. 44,000 Australians died of cancer in 2013, which is the year that the researchers used to make their calculations. But now put some faces on those numbers. Just about everyone knows several people who've died from cancer, whether it's your old Uncle Joe who smoked his way to an early grave, or the work colleague who died from breast cancer, or that nice lady in the sandwich shop who was dead 4 weeks after she was diagnosed with pancreatic cancer. In my own practice, I've seen many people with cancer diagnoses, and not all of them have survived. And every one of those deaths is usually people who came to see me after they'd exhausted all of their medical options and they'd been referred for palliative care, which left really nothing for me to do except kind of hold their hands and try to make their last days on earth bearable. Every one of those deaths still haunts me to this day. To think that 1 in 3 of those women and 2 in 5 of the men might still be alive today if they had made different choices in the way they live their lives. It's sobering, isn't it? But the good news is you can take this information, use it to improve your own health and reduce your risk of cancer. So which behaviour changes offer the most bang for your buck? Well, priority number 1 is quit smoking. It's amazing how many people still smoke. 23% of all cancer deaths in Australia in 2013, that's 9,921 cancer deaths, were directly attributable to smoking and passive smoking. Smoking doesn't just cause lung cancer, but also cancer of the mouth and throat, the esophagus, the stomach, colorectum, liver, pancreas, the larynx, the cervix, the ovary, the kidney and the bladder, and also acute myeloid leukemia. If you've tried to quit smoking in the past and failed, I highly recommend using EFT, emotional freedom techniques, to assist your next quit attempt. You can read Peter Stapleton and her colleagues' paper on using EFT to quit smoking, which I've linked to in the article that accompanies this video clip, so you can find the link to that article below. And you can also watch my interview with my client Heather, which I've also linked to in the accompanying article, on how we used EFT to help her quit successfully. She's now been smoke-free for 3 years after multiple failed quit attempts in the past. Priority number 2, clean up your diet. The research team estimated that 2,329 cancer deaths in 2013 were caused by just 4 dietary factors: consuming too little fibre, which is less than 30 grams per day for men or 25 grams per day for women; consuming insufficient fruit and vegetables, that's less than 2 serves of fruit, 3.5 of vegetables per day; and eating any red meat or processed meat at all. The types of cancer that were caused by these dietary factors are colorectal or bowel cancer and cancer of the mouth, throat, larynx, and lung. A whole food plant-based diet is the obvious solution to this aspect of dietary prevention of cancer. It's impossible to get insufficient fibre when your diet consists of fruit, vegetables, whole grains, legumes, nuts, and seeds. Priority number 3 is to reach and maintain a healthy weight. Being overweight or obese caused 1,990 deaths from cancer of the esophagus, stomach, colorectum, liver, gallbladder, pancreas, breast, endometrium, ovary, prostate, kidney, and thyroid, as well as multiple myeloma. Again, this was in 2013. Once again, a whole food plant-based diet is the most effective way to lose excess weight and to keep it off, because it doesn't require portion control. There's no calorie counting, there's no hunger pains to grapple with, and you'll feel better almost from the moment you change your way of eating, whereas most diets are going to leave you tired and hungry and grumpy. I have hundreds of whole food plant-based recipes to get you started on my website, and my Empower Ed program is packed with resources to make your transition to this way of eating easy and a lot of fuss. Now, increasing physical activity, limiting or eliminating alcohol intake, breastfeeding, avoiding sunburn, and the use of menopausal hormonal replacement therapy are also important considerations when it comes to reducing your risk of developing cancer. And the best part is that the steps you take to help prevent cancer also reduce your risk of other chronic illnesses such as type 2 diabetes and heart disease and dementia. Now, why would this be? How could one set of behaviour changes affect multiple disease processes? Quite simply, it's because human beings are genetically adapted to eat a minimally processed plant-based diet, to be physically active every single day, to not smoke or drink alcohol, to breastfeed our babies, and to spend enough time outdoors to get sufficient vitamin D, but not to sunbake to the point where we burn. And when we follow the lifestyle prescription that fits our genetic inheritance, every aspect of our physical and our psychological function just works better, including our body's capacity to repair the DNA mutations that can lead to cancer and to control the growth and the spread of cancer once it's developed. Unfortunately, the reductionist paradigm in which our current healthcare system is grounded places all the emphasis on the high-tech approaches to cancer, the screening programs that detect cancer at an early stage, which, as I mentioned, in most cases doesn't actually work to prevent cancer deaths, the development of vaccines to try to prevent individual types of cancer, and of course an ever-expanding arsenal of drugs aimed at treating cancer once it's already developed and spread. Simple, cheap or free lifestyle strategies that have the capacity to prevent multiple types of cancer and to improve health in general aren't backed by wealthy and politically powerful industries that could spruik the benefits of these changes either to the public or to health professionals. Cancer is now the leading cause of death in Australia, and the number of people who develop cancer and die from it is increasing year by year, despite declining rates of smoking. Why is this happening? Because our diets are progressively getting worse, so we're getting more physically inactive, and our collective girth is increasing. But in the midst of all this bad news, this new study reminds us that when it comes to nearly 40% of those cancer deaths, our daily choices really do make a difference. So please share this information with anyone that you care about. People tend to assume that cancer is due to bad luck or bad genes. And it's true, there are some cases of cancer that really aren't preventable by lifestyle changes. You really can just get bad genes that predispose you to cancer, but that's a tiny minority of cancer cases. There's so much that we can do to prevent cancer. So enjoy World Cancer Day by eating some healthy food, getting some physical activity, and getting some sensible sun exposure while strictly avoiding burning. And I will catch up with you for next week's weekly update.